Let's go ahead and get started. Thank you for joining day 3 of the CRIO Partner Expo. This is our last day of recruiting partners that we're going to hear from. And then tomorrow we will hear from our site operations partners. So really quick running through the agenda. First, we are going to hear from Omni CRS from George Lott. Then we're going to hear from Patient Qualifier, then OpenPath, and then Ripple Science. So we have 4 presentations for you guys here today. I am your host, Nikki Gandhi, CRIO Community Manager and Head of the Partners Program, and I have Andrew Davidson here from our marketing team as well assisting me. So without further ado, George, go ahead and take it away. Let me just spotlight you. All right, go ahead.
Awesome. Great to meet everybody. Thanks, Nikki. As she mentioned, my name is George Lott. I'm the Clinical Business Development Manager for Omni CRS. We are a patient recruitment organization, and our focus is to deliver high-intent patients for your right studies at scale. Let's see here. So this is a little bit about what we're going to talk about today. So who we are and why it matters, targeting the right patients, where our leads come from, our core channels, the approach we use to reach those patients that you need for your studies, the patient journey from ad engagement to referral, how we actually convert the patients from a lead to a randomized patient, our lead flow process, referral data and compliance, what we actually send to the sites and sponsors, some logic for our screeners, pre-screening details, and how we handle personal information, and then a little bit about the tech and integration, so our sample screener walkthrough, and then how we have actually used the API integration with CRIO. So Omni CRS, we're a leading performance-based digital patient recruitment organization. So we work with the full gambit in this sector. So we work with sites, CROs, sponsors. And so our goal is to give high intent referrals that convert into randomized patients so we can fill studies faster. And how we do that is through our large internal database. We do some internal media buying, as well as our partnerships with vetted third-party marketers in our network. And I think we all know, the path to patient recruitment is rarely straightforward, if ever. It's filled with bumps in the road and obstacles that require some very strategic planning and adaptability at times. So this is what we've kind of delineated here is the main pain points that we see in the industry: patient survey fatigue, clear tracking and attribution of the actual leads, lead quality issues, cost effectiveness, and the like. So these are all the main problems that we look to fix here at Omni. And we've been successfully recruiting studies since 2018. So we work currently in 33 plus therapeutic areas. I think it's up to around 39 now. To date, since 2018, we've had 832,000 qualified referrals. We've completed 500 plus studies, and our pre-screening pass rate from lead gen to pre-screening is 85% plus on the high end regularly. Where do the leads actually come from? So here at Omni, we have an integrated channel strategy. So our goal is to find those high intent patients where they actually live, work, and engage. So most people nowadays are on social media, they're on Instagram, they're on Facebook, kind of doom scrolling through the internet. So we meet them where they are. We have mobile ads, desktop ads, social ads as well. We use aggregator sites as well as emails and newsletters, and then some kind of native niche placements of ads as well. And so kind of anywhere where patients are living day to day, that's where we find them at. These are some of our samples of unique therapeutic areas that we work in and some of the studies that we run. These are, I would say, the top ones that we've been in most recently, where most of our patients come from. So we work with many different sites right now that are working in a lot of therapeutic areas. I don't think that we've found one therapeutic area that we can't find patients for. So if you've got hard to fill studies or something that's kind of lacking enrollment, let us know and we can find those patients for you. And then how do we measure success here? So here at Omni, we're doing performance-based marketing. So the commission is based solely on performance. There's no upfront fees like some of our other competitors. So we utilize a couple different models. We're really flexible on that and we're adaptable. I think that's what sets Omni apart, so that we can find those patients and not cost sites a lot of money up front. Our automated process, the sites and the CROs and all of our other partners have complete control over the creative marketing materials and the messaging. So we make sure that the integrity of your study stays intact as we find those patients. We also have an internal department for traffic quality and a proprietary software. So we survey and monitor all of the leads that we get in to make sure there's no fraudulent leads or false traffic. I think that's really important to keep, those patients super high quality. And then make sure that they make their way all the way to the site once they get the lead is generated. And then we also have a growth manager that works with any of our partners to collaborate, on benchmarks and ensure that performance is meeting their expectations and their metrics, whether it's from lead generation to screening, from lead generation to randomization. We have our growth manager that tracks all those milestones so we can keep track of the study as it goes along. And we're going to jump into a little bit about the patient journey and some of the UX design here. So this is what the ads look like. So we've got a couple different examples here, some native ads, meta ads, which would be on Instagram or Facebook, and then some banner ads, which they would see scrolling through the internet. Excuse me. And through Q2, as of right now, we've had 90,000 plus referrals delivered with an average pre-screen to referral rate of 89%. And the patient's journey, how it works is the targeted ad is shown based on demographics and indication. We build that directly off of the protocol's inclusion and exclusion criteria. It's also geo-targeted, so really close to where the enrolling site is. The patient engages with the ad and they're directed to a screener or a qualifying page and then directly to the screener after that. This is a little bit about the screener build out. As you see from left to right, so this is the first page that the patient sees. It has the type of study it is, their basic contact information. As we move on to the second image, this is the actual kind of I&E criteria that we use to build out the screeners. We work directly with the CRO or the site to, have the most cohesive questions that we can so that we get the most high qualified leads out of these screeners. The PII is held intact with our compliance. This, like I said, the questions are based on study parameters, and then everything is geo-targeted for proximity to the site. So that's within 30 to 50 miles. That's what we normally focus on. And then a thank you page to the patients as well that gives the direct contact information to whoever's running the study. So if the patient wants to reach the site directly, they have that ability, which I think is important. And then this is a little bit about our API integration with CRIO. So what this really does for sites is it shaves down that workflow. If you are a CRIO site using CRIO, we have seamless data delivery and integration. I think that's really important. So the biggest part, of course, is the automated referral transfer. So as soon as we find a lead generated for a trial, we can instantly send those pre-screened patients directly into CRIO. That saves a lot of time for the patient engagement and the recruitment teams on site. They don't have to go hunting for those leads or log in, excuse me, or log into a different system to retrieve those leads or get them sent as a raw file or an Excel spreadsheet and then import them into CRIO, which is just a bunch of extra steps. So that's the biggest takeaway, I think, from the integration, which is great. It's secure and compliant, so it's HIPAA compliant. Well, we have encrypted data transmission with our own audit trails, custom mapping. So we have flexible data formatting, so we can match your intake fields and workflows, whichever fields you want ported over, we can have those. Real-time updates, so we push new leads as they come in. The status changes if a patient has been referred or enrolled into a study or randomized. We can see that referral activity in real time, which I think is great for us and great for the site. Two-way communication, so we enable feedback loops for status updates, enrollment progress, and then it's definitely scalable. So we're designed to support multi-site and multi-study configurations. So if you are an individual site or you're a network that has 20 sites, we can make it work either way. So that's really great. And then across multiple studies, I came from working at a site network, smaller one. So, we had 20 studies at a time. So whether you've got 2 studies or 20 studies, I think the integration makes it super easy for you guys to get those high intent patients in real time. We've got about 5 minutes left. So if anybody has any questions, I'll open it up for questions now. If anybody wants me to go back to any slides, feel free to drop a question in there. I can go back. But here's our contact information. always looking forward to people reaching out. If you have any questions, you can contact us directly. And yeah, we appreciate CRIO holding this, and thank you.
Yeah, thank you. I'll give it a few seconds to see if anyone has any questions for George or the Omni CRS team. And if you do have questions or you think of them later, you can always find Omni CRS's listing in the CRIO Partner Directory as well. You could submit an inquiry directly through there via the Contact Us button. You can again enable integration with Omni CRS with the click of a button via the listing as well. So thank you, George. We appreciate it. And we will meet back here in about 10 minutes at 11:20 Eastern time. Thanks.
Thanks, Nikki.
Thank you. Alrighty, let us get started. I'd like to introduce Dr. Bhargava from Patient Qualifier, who's going to present next. Let me just spotlight you and feel free to take it away.
Well, good morning, everyone. Thank you for joining us. I'm Dr. Anuj Bhargava. It's a pleasure to be here. Thank you to CRIO for inviting me, and to Nikita, who, the founder of this marketplace. So great job. Delighted to be here. I'll get started. I'll share my presentation. Let me know once you see my screen.
Yes, I can see it.
Excellent. I'll move to presentation mode. If you guys have questions, comments, please definitely put them in the chat. My team is looking at them. I won't be able to see them while I have my screen on. All right, well, let's get started. So Anuj Bhargava, endocrinologist, founder of a research center called Iowa Diabetes about 18 years ago. Learned a lot during that time, saw a lot of opportunities and challenges. So about 10 years ago, we started building Patient Qualifier. It has been a great journey. We are in Midwest, a small town, but we are nationally known in diabetes. And Patient Qualifier gets a lot of credit for that success. So today I want to share that story, that journey, the paradigm with people attending. And we are an independent research center. We became in 2017 or so. And Patient Qualifier was a huge help as we became an independent research center. If the audience wants to put in, if they are part of an independent research center, as in no healthcare system attached, they could be part of a chain. Independent versus attached, I'd love to know that of the audience. So with that said, I'll get started with this. And this is, for last 10 years, I've been talking about this paradigm shift. I think with the way research is going, we really need to see things differently. The current paradigm is recruit from a database one trial at a time. And my paradigm, our paradigm, patients qualifier paradigm for last 10 years has been, well, no, you enroll from a connected, engaged community, lifelong for multiple trials. Now, you may ask, what does that mean? Connected, engaged community, lifelong for multiple trials. Let me explain it in a different way, a financial way, first of all. So let's say a center is doing 3 trials, right? So they get X number of patients. These guys enroll in the study and they get the red carpet treatment. These patients usually get forgotten. We earn our revenue, let's say $20,000 per 10,000 per patient. And at the end, we end up with $60,000 revenue for the study. Again, just hypothetical example. The most important part in this part of the slide for me is this, the not qualified leads, and that's what I want to focus on. So the paradigm emerging research centers to think about is connect real-time, lifelong for multiple trials. And again, what does that mean? That means is this, in this case, those 4 patients, we are going to do this. We are going to make them part of our community. If we do, our funnel is wider, so hopefully we can recruit more patients in the next trial. And again, we'll do the same again, and again, and again. And hence, our top line could be much better and much more revenue. And that's has been one big part of our success is this paradigm shift. So you may say, well, how do we do that? And I think that's where we come in. So again, a paradigm shift, I say, is instead of not qualified leads, think about not qualified today. Not qualified today, but of course, in the future. This is the hidden treasure, the gold, those leads. So with Patient Qualifier, we bring all the leads into one place, everything from your website, forms, referrals, events, the digital advertising mediums, recruitment companies. And so all of that comes into one system. We have a comprehensive lead management system. We also offer marketing services if people want to use them. And typically we are 3 to 5 times more effective than central campaigns, 3 to 5 times. All these leads come into this place, and what it shows is all the leads. Let's say we had an event on Sunday. By Monday, all of these come in. Our recruiters start working on Monday. The system can tell you the source. It also has a very smart engine behind it where it will delete the duplicates or update things and so forth. So that really helps in managing the leads very efficiently. As I said, the hidden treasure is the not qualified leads, and we need to also focus on them. I say change our paradigm. Instead of not qualified, we say not qualified today, not qualified just today, but in the future, yes. Give them equal importance and then engage and nurture them for future studies. And then you will say, how? Come on, we don't have time to do this. Our recruiters can barely call the patients who are for the current study. So how do we do that? Well, this is where patient qualifier comes in again by saving time and effort with automated communication flows. So some examples, and I can't give all, but I'm giving you some examples. Stay in touch year round. Happy birthday messages was the most revealing for me. When my patients started hugging the coordinators because nobody else wished them except us, it was crazy. That was a relationship building moment, and we do a lot of that. Also, inform them about medical breakthroughs, side events, upcoming studies, etc. So what is an example of an email? These are automated emails which can talk about, hey, here's something about fatty liver, here's something about a few other things that we offer. So these things can be done automatically with the patient qualifier. For all the leads, those don't qualify today or otherwise, patient qualifier allows you to respond to these leads immediately, efficiently, and or automatically. So we have these instantaneous automated messages like, hey, thank you for coming to that event. It was great seeing you. Thank you for your interest in FibroScan and so forth. And then calling patients with dial-free phone calls where not only we can just dial through the platform, it also logs everything, what all calls were made. We have many custom templates that are very easy to build and save, and I showed you one of them. And then sending ICFs is so easy with the platform. So those are some mechanisms. And I think in part of the building community, you also have to know your patients and build trust and relationships. That's where, again, patient qualifier comes in. Patient qualifier tracks all the patient communications either automatically or manually. There's an extensive tagging system and timelines and notes, and I'll share that in a moment. One key benefit is when we put all these notes together in the system, it really brings the knowledge about a patient to the patient qualifier. And what that does is the knowledge remains with the institution and not with the recruiter. In this day and stage of high turnover, it's really important. PQ gives us that differentiation that others don't have, is that the knowledge remains with the institution. What kind of knowledge? Let me show you. This is each patient's dashboard, many different tagging systems. Also, the trinity of clinical research is three things: labs, meds, and conditions. It's right there on the platform. So those three things, very easy to look at. Recruiters can quickly say somebody's eligible or not. Now, the unique part of the system are the contact list tags and the timeline and notes. And I'll show that in a little more detail. For example, this says this patient is highly interested in device studies and in weight loss studies. They have completed 3 trials successfully. They also didn't qualify for something. And that's very useful information. That can be recruitment related. Where did this patient come from? Dr. Jane Doe referred the patient. Those kind of things can show up. So we know a lot about the patient very quickly. And then we can manage these patients very well. And I'll show you this. Ben recorded this video yesterday. So here we can add tags like patient is interested in type 1 diabetes study, highly interested. Once it's saved, then we can go to the main dashboard. And in the main dashboard is where recruiters always work. If I can show you in a moment. This is the main dashboard, the leads on the left and follow-up. Here we can put these tags very quickly, and the instantaneous nature of this platform is so cool. Like the query was done. The query was done. And then we can send group text messages by using a custom template. This is really designed to save time. Time is money. So this is designed really to save time for the recruiters. And then all these tags show up. And as you can see on the bottom left, the SMS text message sent is also there. So it got logged. And then we generate this very generous and detailed timeline where some notes are important and others not. We can sort by that. And we can really know the patient extremely well. So that's how we can build relationships with the patients very, very well. I also urge centers to really focus on Google and Facebook. We have an Iowans with Diabetes with 1,200 members and great reviews as well. So just an advice for communities. The next thing I want to talk about briefly is this query, which was the number one reason I made Patient Qualifier. This is instant query. I can be on the phone with the sponsor and quickly tell them if they change the A1C from 7.5 to 8, what will happen to the number of patients we can recruit. And then we can send them mass email queries. So this is done on my laptop. I'm looking for type 2 patients. And this number at the top right changes instantaneously. So we'll put A1C, age, BMI, some of the top criteria for these studies. Now in the EMRs and CTMS, you put 2 or 3 criteria, generally they fail. They can't do this. You will see how many criteria we can put in here. So BMI and so forth. And then we can go into medications. We have a group of pharmacists who have designed this medication database. It's RxNorm and DC linked. And we have made groups and subgroups, which make it super easy to now select or deselect medications. And again, these numbers change constantly as soon as we are putting the numbers in. Hey, let's exclude weight loss medications. Lastly, we can do some very unique things like GFR or other things. And we can say, hey, we want a GFR between certain values, and we can put that in. So now think of how many things I have placed here. I click run, and I can never finish my sentence before this gets done. Never. Never. That's why I call this query the instant query. And this is so helpful to our leadership team, to our recruiters, and everyone. The last thing I would focus on is how does it work with CRIO? So we were probably one of the first, if not the first one, who built API with CRIO many years ago. And this has allowed us to really design an ecosystem that makes it very efficient. Our recruitment is very streamlined. There's a two-way integration that simplifies the recruitment process for screening. Now, you may ask, hey, where does people work in which platform? So at our sites, we recommend recruiters work in PQ and coordinators work within CRIO. And then any patient that gets added to Patient Qualifier gets automatically added to CRIO. No need for duplicate work. And then on the screening visit, when a recruiter is arranging a screening visit, that's when they go in CRIO and arrange the screening visit. Again, seamless data transfer. I'll show you what all things get transferred. And it just leads to the simplified enrollment that is, again, very beneficial to our recruiters and coordinators. So this is what it is. New patient gets synced. Demographic, contact info, labs, vitals are all two-way syncs. And then we also receive from CRIO study name, study status, and their visits. So that's how this is built. We continue to make this interface richer over time. In summary, PQ really accelerates the recruitment, huge time saving. The number of calls, people can make way more calls. Each call, they save substantial time. And then the instant query is another differentiator. And our medicine library is another differentiator. This is the slide you guys might be waiting for, almost the last slide. So my message to centers: enroll from a connected, engaged community, lifelong for multiple trials, lifelong for multiple trials. So first, build a community of engaged, connected patients. Second, know these patients, build that trust, build those relationships with these patients. And Patient Qualifier can help do some of these things. You saw a comprehensive set of time-saving recruitment tools with automations. You saw an extensive searchable tagging system and detailed timelines and notes. And I can't stress enough how much time this saves, how our recruiters sound so much more knowledgeable talking to any patient, and how recruiters' turnover doesn't impact our relationships. And then find the right patients rapidly with our instant query. So that's a summary of the platform. I think I'm getting close here. This is the last slide. So again, enroll more patients better and faster now and in the future. By embracing this new paradigm, enroll from a connected, engaged community, lifelong for multiple trials. The last thing I would say, if you are interested in this or hearing my journey, and I would have this open offer for owners and founder of Research Center, I'm happy to engage with you, regardless of patient qualifier, to share my story, my journeys, and guide you, advise you, and mentor you on building your research center. That's an offer beyond patient qualifier. Back to patient qualifier, you can take this QR code and submit a form to us if you are interested. And also, please know that because we are very appreciative of CRIO help giving us this opportunity, the first 5 people who get there will get 50% off the subscription for first 6 months. So with that said, I think I've come to my close with 1 minute remaining. So I'll stop sharing my, I'll leave it on for just a couple minutes more in case people want the QR code. If there are any burning questions, I'm happy to answer.
Thank you so much, Dr. Bhargava. Great timing. Thank you for also honing in on the importance of creating and fostering a patient community. I think that's very important. I'll leave a few seconds here. Any questions for Dr. B? And if you do come up with any questions, then feel free to jump into their listing in the partner directory as well if you'd like to submit an inquiry there. Next, we are going to hear from Justin Kennedy with OpenPath. So we will meet you back here in 5 minutes. And thank you so much, Dr. B.
Well, thank you. It was a pleasure. Thank you.
Thanks. All righty, let us get started. Now we will hear from OpenPath. Justin, let me promote you to spotlight. All right, go ahead and take it away.
Okay, let me bring this up. There we go. All right. Good morning or afternoon, everybody. My name is Justin Kennedy, one of the co-founders and CEO here at OpenPath. Delighted to be able to speak to you guys. And I think we're one of the newer kids on the block, so to speak, having done our CRIO integration in the last probably 60 days or so. But I'm excited to share you what we're working on and kind of what the future holds for what we're trying to bring to the clinical trial site environment. Going to go over a few things, talk about what we refer to as our pre-screening model 2.0, and then some of the strategies that we're currently using to use our agentic AI product to help clinical trial increase the efficiency of their operations. So we started OpenPath with myself and one of my founders. We come from kind of the big tech and AI machine learning background with some previous companies with some industry veterans that run clinical trial sites themselves. And one of the things that was constantly brought up as being a problem in this industry is essentially patient engagement, specifically with patient recruiting. There was a lot of concern that was brought up to us about the largely analog and manual process of contacting new leads, potentially those falling out and becoming lost. And then how do we keep patients engaged through the trial recruitment process and making sure that they completely or successfully complete a trial? What we are focused on is what we're calling the pre-screening model 2.0. And we're looking at that through kind of 3 separate lenses. One is the ability to utilize agentic AI to engage with patients at speed and scale, using agentic AI to automate and optimize some of the pre-screening workflows to bring time back to the people that do the work and let them focus on what they do best. And then appointment reminders and check-ins. Our focus at OpenPath with this platform is by building digital labor that focuses on taking the things away from the people involved. That is the low skill, high time work, allowing the individuals at these clinical trial sites essentially to focus on what they do best. So for example, maybe a site gets 100 leads and they only get to 30 of them in a day. What we would suggest, or what we're focused on doing, is providing an AI solution that can reach out to those 100 leads, qualify them to some basic level, and allow the people to focus on what they do best, which is get them in the door through the pre-screening and qualification process. Another example would be appointment reminders. A lot of the sites we talk to, a vast majority of the day is taken up by coordinators and recruiters calling people, trying to remind them that they're supposed to walk in the door, making sure they have transportation, answering questions. Those are things that are also being able to be handled by our agentic AI solutions, and returning that time back to the individuals to focus on the stuff that they do best. So how is this all working? So we focus on building two separate products within the platform. The one product is kind of the upfront thing that is the selling point, or the thing that catches people's attention. That's our agentic AI solutions. So we build specific micro agents that are focused on specific task-based outcomes. So we are not in at OpenPath, we do not believe that AI is ready to take over wholesale entire portions of people's operations, especially when it comes to engaging with the most valuable resource that clinical trial sites have, which is their subjects and their patients. So we're focused on building specific micro agents for specific tasks that can help out where the clinical trial sites see the most efficiency gained by it. So for example, we have an agent that is specifically dedicated only to recruiting. That's all it does. There is nothing else. It's entirely trained on making sure that it is able to reach out to new leads, qualify them in the way that the study and the clinical trial site would like us to do, and then get that patient in the door. The other side, on the other side of that agentic AI solution that we're building, is actually what I think is the more interesting part, and the thing that actually may have more value for clinical trial sites, which is the connective tissue between the disparate platforms that clinical trial sites use. So one thing that we are aware of that clinical trial sites struggle with is the need to work in multiple platforms in order to get basic execution and basic operations done. For example, let's say like a feasibility study. If you have a feasibility study, you have to log into maybe 3, 4, 5 different platforms in order to run a separate query in each one. You have to bring it all back into maybe to a spreadsheet, deduplicate that subject list. It's a mess, and it takes up way more time than it should. So we have, for example, an AI agent that is specifically designed to monitor and connect to the disparate platforms that individuals might work with, whether it's different EMR systems or other platforms that provide access to subject records for searching. The focus that we have is bringing all of that information back into the OpenPath platform, so that instead of having to do a query in a half dozen different platforms, you do it directly through OpenPath, and we make the query into these other platforms and bring them back into a central location for you guys to work with. So along with both the agentic AI solutions, and then built on top of this connective tissue API framework that's bringing together all the different platforms that you work with, we think about the execution in kind of these 3 large buckets and how we can provide value. One, speed and scale. That's simply the ability to get leads able to be actioned on in a faster time period. So for example, one of our client sites had a 72 to 96 hour turnaround time from the time period that they filled out a Facebook lead to when a recruiter could reach out to them. We took that 72 to 96 hour timeline down to 1 minute, and they're able to, their recruiting efforts has seen a marked improvement in response rate by allowing their recruiters to reach out to their potential subjects faster. On the scheduling and logistics side, we're able to, we have an agent that's dedicated just for patient engagement. And you know, people usually think about that from like appointment reminders or medication reminders, but it's also generalized patient engagement during a study. For example, we have an obesity trial that's going right now, and we are providing a patient engagement strategy for the site, specifically for the placebo subjects, in order to keep them engaged throughout the entirety of the study and make sure they complete it. I think one of the the secret sauces that we have and what we built is the modularity and flexibility in the AI solutions that we have, because we understand at OpenPath that not only does clinical trial sites each have their own challenges with their local population and in terms of subjects and how to engage with them in an effective manner, we understand that each trial is not should not be treating the same way as another. An MDD study is not the same as an obesity trial. A healthy type 1 vaccine study is not the same as an Alzheimer's. And we give the ability for these agents to be trained uniquely and specifically and tuned directly on a trial-by-trial basis, on a site-by-site basis. And then the last one, the last bucket that we're looking at is this insights and reporting bucket. And this is one that, again, is not necessarily a headline grabber in terms of on a marquee somewhere, but we find that this is lacking in a lot of places at the clinical trial site level, where you ask someone, well, how much did it cost for you to bring a lead for this study? You know, how much, what was the cost per action? What was the CAC? And it's difficult, if not impossible, for a lot of clinical trial sites to answer that question. With our ability to bring the data all into one place, including multiple recruitment channels, including multiple platforms, being able to aggregate that data in one place allows us to provide that reporting and insight for the operations team to monitor the effectiveness of the campaigns, along with other insights and reporting that lives inside the platform as well. We also integrate directly into multiple CTMSs, specifically into CRIO. That's probably our richest API integration so far, but we do support others as well. And what are some so far? So one thing, like I said, we're kind of we're definitely in the early launch phase of the platform, and so we're focused on very specific problem sets that we're trying to solve. One of the ones that is the easiest for us to provide value is by providing an agent that can provide coverage for your recruiting team when there are gaps in your normal business hours. So for example, on weekends, nights, holidays, making sure you have that speed to lead in place by utilizing OpenPath's recruiting agent enables those subjects and patients to be reached out to in an efficient manner and get them scheduled with an appointment while the study and the outreach is still top of mind for them. This is an example of some of the pipeline and insights I was talking about. You know, we're able to bring these things all into one place so you can see exactly, you know, what is my cost per lead? How much did it cost me to schedule my visits? What about screenings? What about leads? This is the level of detail that we're focused on providing through the platform and through the integrations that we provide. And this is able to be broken down not only by down to recruiting source, but it's recruiting source down to a study, down to an individual site if needed as well. We have kind of a multi-layer view of our data. There's a top level UI that gives us over, you know, high level views, high level data. And then each one allows you to drill down into each one and see exactly what went on. So there's agent activity, there's agent engagements, there's upcoming appointments, there's an outcomes widget. So, you know, of all the people that reached out to you yesterday, what has been the outcome from the engagement of the agent with that? Who's going to be coming in for an appointment? Just things like that allows for the at a glance what's going on, and then if needed, digging into it and getting more information on it. And then all of this is able to be brought back into CRIO via our API connection with them. So we have the ability to bring entire patient records over into CRIO and update accordingly. You know, this helps with preventing errors, speed to lead, deduplication, the ability to automate this and facilitate this through technology is going to be a requirement. It should be a base level thing that everybody is looking to do in the near term. And that's what I got for the presentation today. You know, as I mentioned, we're in the soft launch version of the platform. What we're currently looking for are beta partners, essentially, that are going to help us validate the platform that we built. They're looking to, I'm looking for people that kind of want to lean in and help shape the guidance and the direction this platform goes. And thank you, Nikki, for setting this up and allowing us to present. And I look forward to being able to answer anybody's questions.
Thank you so much. Any questions for Justin? All right. If you guys do, you can find OpenPath's listing in the CRIO Partner Directory. Feel free to submit an inquiry and also check out their descriptions for services and such. You can also enable API integration with them with the click of a button via the listing as well. So thank you so much. And
Thank you, guys.
thank you. Next, we will hear from Meredith from Ripple Science in about 5 minutes. So everyone, feel free to grab a cup of coffee, take a break, and then we'll meet back here in 5 for our very last presentation of the day. All right, let's go ahead and get started. Meredith, thanks for joining us. Meredith is with Ripple Science. She'll be our next presenter. And feel free to take it away.
So hi, everybody. Thanks for joining today. For those of you who don't know, I am Meredith Platt, Vice President here at Ripple Science and actually a former customer of Ripple myself. I'm really excited to walk you through our platform today and talk about how Ripple is helping research teams simplify one of the most time-consuming parts of research, and that would be patient recruitment and pre-screening. So today we're going to focus on how Ripple integrates with CRIO and how together we're bridging the gap between recruitment services and clinical trial management systems in an effort to help you save time and eliminate duplicate work. So let's start with the problem. Most CTMS platforms, CRIO included, are excellent at managing studies and enrolled participants, but they're not really designed to support all the work that has to happen before that point. And that can be intense. So we're identifying potential candidates, we're reaching out, we're pre-screening, we're documenting all of those interactions, really tracking every step that we're taking from first contact all the way through consent. And for many sites, this is still handled in spreadsheets and shared inboxes and disconnected tools. And the result is really a lot of missed opportunities, inconsistent follow-up, and some swivel chair work, manually copying and pasting data between systems, introducing delays and errors that are really unnecessary. And that's exactly where Ripple comes in. So Ripple is purpose-built to support that front end of the clinical trial process, the recruitment and pre-screening engine that sits upstream from your CTMS. It's designed for lean sites, central recruitment hubs, and essentially anybody who's looking to find patients and enroll them faster with fewer resources. So with Ripple, you can build a secure and searchable participant registry across multiple studies. You can track and manage every contact and interaction with all of your participants. You can launch targeted outreach campaigns and automate follow-up activities. And then you can pre-screen candidates and determine their fit for a study, all before handing off to a CTMS. So now let's talk about the integration between CRIO and Ripple and how that really is a game changer for teams. So as soon as a participant is identified as potentially eligible in Ripple, their information is automatically sent to CRIO with no extra steps needed by study staff. We've got built-in indicators within the platform. Built-in indicators within the platform to tell your team when there are potentially errors, whether it's system related or maybe there's a problem with the format of perhaps a phone number or an email address. Those indicators here, you'll see them in red, green, and orange, help your team understand what might be wrong.
Meredith, really quick, are you screen sharing?
Yeah, are you not seeing it?
No, we're not seeing it.
Okay.
Do you see the green share button with the arrow?
Yeah, and it actually says I'm sharing.
Oh, sorry.
That's
Then
okay. Let me try again.
people are saying they can see it, so that's good. It might be
Okay.
a me thing then. Sorry.
That's all
Sorry
right.
to
Let me
interrupt.
just, I stopped sharing and let me share again.
Sorry about that.
That's okay.
Okay, for some reason I can now see, but I'm glad everyone could. All right, continue.
No problem. Okay. Back to where I was. Sorry about that. So our partnership with CRIO eliminates a lot of duplicate data entry. So you're not swivel chairing back and forth to re-enter information that you had already entered. We're eliminating wasted time and copy and paste errors. So from the moment that participant shows interest in the study, Ripple handles the recruitment and pre-screening and then hands off seamlessly to CRIO for enrollment and management in the study, keeping that participant's journey connected from start to finish. One of the most powerful tools that Ripple offers is our patient registry. So think of that as your own private database filled with all the people who've expressed interest in your research. Maybe they've joined a past study or they've been referred by a physician or an advocacy group. Every participant in Ripple is secure. So Ripple is HIPAA and SOC 2 compliant. So you can trust that your data is protected. Every patient is fully searchable by key demographics, study interest, health characteristics. And their profile is continuously enriched over time as they participate and engage with your site. On the next page, we're going to watch a short video just to see how really easy it is to filter a participant registry. So here I am filtering for, I'm going to look for patients that are over 21 that have sleep apnea and are not pregnant. So I'm just going to set the filters here on the left side. I can add as many or as few as I want. And as I do that, and then I'm going to hit apply, all of the contacts in the center there are going to dwindle down to only those that fit that campaign. So here I'm adding those that are not pregnant. They're 21 or older, and they have told us that they've got sleep apnea. Now I'm going to search, and I've got a handful of patients here. I'm simply going to select them, and I'm going to put them in the sleep apnea study, where some automation is going to kick off a invitation campaign inviting those folks to participate. Next, I'm going to do another filter, and I am going to look for patients that have diabetes, do not use alcohol, and are non-smokers. So I'm setting my filters here, looking for diabetes. Now I'm going to add in the alcohol use. And again, all of the filters that I'm searching for are fully customizable. You sort of craft the data that you want to collect when you construct your studies and your registry. So here I've got one patient. I'm going to add them to the diabetes study. Hit apply. They're popped into that study now. And however I've built my automated campaign to target those customers is kicked off immediately. So this really means that you're not only relying on luck and recruitment partners alone, you're really building a sustainable recruitment momentum within your own site. I don't want to diminish the relationship we've got with recruitment partners. They can be incredibly successful. And Ripple works really great with them as well. So instead of those partners supplying lists that they've generated from ads or flyers or QR codes, whatever method they're using, we can point those recruitment partners' finds directly into Ripple. So those patients end up right here in your registry as well without manually entering them. So once a candidate is interested and you've identified them and loaded them into your study, Ripple guides your team and that potential participant through a standardized pre-screening process, one that you set up yourself with simple point and click tools. And what's really exciting about that is you can define those workflows and customize them based on characteristics of the participant. You can capture notes, update statuses, record eligibility decisions, all logged, reportable, and ready when you need it. Now we're going to watch another short video on how truly easy it is to configure Ripple for your studies. So in this example, I'm assigning a quick study name. Now I am going to input some statuses, quite simple, just to follow the flow of this particular study. As you're watching the video, you'll notice that I make a couple mistakes, quickly come back and fix them. You don't need to be an IT resource to configure this system. I'm not an IT user. And I'm not an IT person. And when I was a customer, I was very often referred to as a power user. It's quite simple to use. Now I'm adding in a couple of different events. This is a consent visit that I'm scheduling a expected window off of an intake event. And now I'm creating a real quick pre-screening survey. Again, drag and drop question types. I'm going to change the name of that question. Do you smoke or vape? Now I'm going to update the choices for the patient to select. The patient can fill out these surveys or they can be done internally by staff. So we see a lot of teams, maybe they're using a call center to do that initial pre-screening. Perhaps call center, you're not entirely sure about their skill set and if they've really been trained to do this. You can build the surveys and customize them in a way that it removes all of the decision making. So a call center team is not determining if they are eligible. The system is telling them what to say next. They're using these surveys as call scripts. Here I'm adding in the choices for this particular question about how long they have had diabetes. And you'll see in just a quick second here that I'm going to add some logic on this question. So it only populates if they tell me they do in fact have diabetes. Real straightforward. Somebody without a lot of IT experience can really become an expert in this system pretty quickly. Okay. On the next slide, so what does this actually mean in practice? For research teams, it really means that we're faster, more consistent enrollment. We've got no more duplicating efforts between the enrollment process and your CTMS. We've got higher data quality thanks to a direct integration with CRIO. And most importantly, we have a better patient experience because your team can really focus on relationship building rather than managing spreadsheets. And for sites using both Ripple and CRIO, the results is really a clean and continuous workflow from first contact in Ripple all the way to enrollment in CRIO, with every step along the way documented, searchable, and auditable. That is really my presentation today. Ripple is really more than just a recruitment CRM. It's the connective tissue between outreach, enrollment, and your CTMS. So with our integration with CRIO, you don't have to choose between being efficient and compliant. You can really do both. So thank you for joining me today. I'd love to answer any questions you have, and I invite you to check us out on CRIO's partnership page.
Thanks, Meredith. All right, any questions for Meredith? Feel free to chat them if you have any. Or like Meredith said, you can jump on over to the Help Center into the partner directory and search for Ripple Sciences listing.